Digital acceleration is here. Health systems are walking the path, but are they in the right direction? Welcome to Patient Journey Pioneers, roadmaps from the top digital leaders in healthcare, who share insights and strategies that are pushing the patient journey to new heights. This podcast is brought to you by Hyro, and I'm your host, Liat Kozuch. Let us get to it. So amazing. Hello, everyone, and welcome back to another episode of Patient Journey Pioneers. I'm your host, Liat Kozuch, and today we have Robert Bart, CMIO at UPMC Health Services Division, who I had the chance to meet in person, actually, at Becker's annual meeting in Chicago this year. Rob, it's so great to have you with us.
Thank you. Thanks for having me, Liat. I look forward to chatting with you and your listeners.
Thanks so much. And we know that under your leadership, Rob, at UPMC, you've increased a national reputation for innovation in medical informatics that improve patient care. And you also continue to see critical care pediatrics patients, correct?
Correct. I'm down to 1 week a quarter, so about 4 weeks a year in the pediatric ICU, as my sort of daytime job, so to speak, takes over most of my duties.
Good. Well, you're doing a lot. And before we actually dive into our questions, I do want you to share about your journey in healthcare, how it all began, and then we'll dive into our questions today.
Yeah, I've been involved in healthcare for 30 plus years now, and healthcare IT or technology probably for about 25 years. Being an intensivist, working in a pediatric ICU when I was in training at Duke University, I was involved in sort of one of the first electronic flow sheets that was used in the ICU space, and that sort of piqued my interest during my training. And then while I was at Children's Hospital Los Angeles, there was a gentleman who was the CIO, John Patterson, who sort of recognized my interest and my skill set, and sort of asked me to get engaged with their journey through an electronic health record. And from there, sort of the rest of my career sort of blossomed. I stopped on the vendor side, working as a CMO for the Cerner Corporation. I was a Chief Medical Information Officer at the Los Angeles County Department of Health. And then now I'm a Chief Medical Information Officer here at UPMC.
Quite a journey. Can you share with us what the most important thing you're working on today when it comes to the digital patient experience?
I think the experience of the pandemic has really accelerated sort of healthcare's transition from a traditional, somewhat digital, somewhat analog world where everything was digital in the sense there was phone-based, people were using websites, but a lot of the interactions were facilitated by a person in the middle, a patient or potential consumer or customer reaching out to the healthcare system. They may use the website to identify something, but at the end of that, there was a phone number. They ended up having to call someone. There was an interaction, and then something else digital happened that may have come back to them in their patient portal on their smartphone. I think one of the areas that's most interesting to me, and the area that we're really focused on here at UPMC, is how do we take that whole process, eliminate all of the manual human steps, and create an end-to-end digital process that allows consumers or patients to actually be much more self-service in the way that they seek care. There's some evidence as it relates to missing appointments, which unfortunately happens, that if someone actually has the control to schedule their own appointment, there's fewer missed appointments than one where you call a call center, or when they ask you as you're leaving the current visit to schedule your next visit. Certainly in that experience, I'm one of those people when they ask me to schedule my next visit, they shout out some date and time, and I'm like, yeah, that works. And then I get home and realize, yeah, that's not going to work. And so then I have to go through something. But if I actually can control that experience in interacting with the healthcare system, I think we'll have people or customers and patients who are much more engaged, but also much more satisfied with the type of service they get.
Right. That is what today's world is all about. I think it's almost a given by now that this is what should be in place these days. What tools are you using to make this a reality?
We've embarked early on in the pandemic. We actually turned on a new Find a Doc physician solution. That just embarking on that within the first 2 or 3 months of that pandemic, sort of in the May, June timeframe of calendar 2020, that was a huge transition for us. That then allowed us to actually transition into new tools to allow some digital self-scheduling directly from that solution. But I think that's only one mechanism of reaching out to consumers and current patients. And I think that we need to look at many other tools that layer or sort of wrap on top of that allow us to engage consumers who might be patients or current patients in future interactions with us. And that's the piece that I think is most intriguing to me. I'm interested in solutions that are much more of a platform that allow you to sort of plug and play the things that will work well for your environment, as well as to sort of curate them in a manner that works well for how UPMC wants to deliver healthcare.
So we talked about this when we sat together at Becker's, and I am interested in knowing, when you embark on these digital transformation projects, what is your process for defining KPIs to guarantee a successful outcome?
I think one of the main considerations is that I think the first step is the digital process. They have to be adopted and integrated and owned by operations. I think one of the mistakes I've certainly made in my career, and I think other individuals in healthcare systems have made, is they have the traditional delivery apparatus or access apparatus, and then they try and stand up a digital apparatus in parallel. I think the current state of the industry, that doesn't work well. You actually have to figure out how the current process and apparatus transforms itself into what the new is going to be. So that's the first step. It's really getting that integration and the operational ownership. This shouldn't be something that I do as a technologist or an informatician. It should be something that is a shared ownership between the operations and the people that I work with and represent in pulling this together. I think the KPIs have adjusted over time, right? And they actually aren't that different than the traditional KPIs of, how many appointments are scheduled, how many, what's the third next visit time period. All of those traditional ones should actually be the same ones. I think sometimes when people embark on these digital journeys, they get attracted to things like net promoter scores and other aspects that represent use of the digital tool set or solution. But at the end of the day, it's not the use of it that's important. It's how many of those activities actually translate into scheduled appointments. How many of those activities actually translate into someone identifying the clinician they need and identifying the type of templated appointment they need to therefore schedule. So it goes back to very traditional, scheduled appointments, completed appointments, no-show rates, all of the traditional metrics of access of care, all the traditional metrics of the efficiency and effectiveness of an ambulatory care aspects of a healthcare system. The metrics really haven't changed. It's the mechanism of how we get someone to complete the process to generate those metrics. I think we end up getting finer detail and higher quality information because every step is digitally captured as opposed to in the analog model. But at the end of the day, it's really, how many appointments were scheduled, how many appointments were completed, how many were no-shows, why were those no-shows, trying to understand that and trying to understand how we can facilitate each step of the process.
Interesting. And a great aspect of AI is that it provides us with these actionable insights, from behind the scenes and a hyper-focused lens on what is actually going on and what is being seen through from A to Z. So luckily we have those tools as well that don't necessarily need a human to be involved. Now, what's a challenge that healthcare executives like yourself in charge of these patient journeys face that isn't being talked enough, in your opinion?
I think it's the cultural change of the healthcare system. Healthcare systems, although we've added technology over the last 50 years, they've predominantly functioned in the same mechanism of care delivery. I think that's particularly true here in the U.S. You can go into multiple different numbers of the top 10 or top 20 healthcare systems in the US. They might have a slightly different flavor, but they're still all doing about the same process. And so I think that to me, that signifies there's a big shift in the culture of how we think about healthcare and how we think about accessing and delivering healthcare that needs to occur. A simple example is for many years, a given physician or APP schedule, it was referred to as the physician schedule or the APP schedule. So it was predominantly structured frequently around that individual's preferences, right? Well, that my preference as a physician might not meet the needs of the patients who want to seek care from me.
Good point.
And so we have to strive to reach a different balance where it does meet my needs as a clinician and how I want to deliver care, but I'm also reaching out and meeting the needs of how the patient wants to access and wants to receive care. And we have to create a better balance in that interaction and in that conversation. And so that's actually one of those cultural points that needs to change. And we really, I think when you ask a physician or APP, they always say they're here for the patient, but we now have to represent that in how we interact with the healthcare system to be there so that the patient can interact with us.
How do you overcome then those gaps? How does one overcome and create a more streamlined process?
It's definitely a challenge. I think, there's all these adages about how, culture eats strategy, et cetera. And I think it starts with aligned messaging at the top of an organization, constant and consistent messaging from the leaders within the organization that's pushed down throughout all of the multiple layers, getting to the people who are actually at the edge of care delivery. And I think it's consistency and constancy over time that is what's most important. You'll have, in any transition of culture, you have those who are the willing early adopters,
right.
And they hopefully can be some of the proselytizers of those people who are next to them. But you also have those stalwarts who are like, I've seen this story before and I'll wait it out, right? And you have to be more patient than they are. There will be a point, I think, that when you can convert your culture enough, that those last remaining groups that are resistant to change,
the late adopters, yeah.
There'll be a point where I like to think of this as a train going by a bunch of stops. You'll have a stop. You'll have an opportunity to get on the train at many different stops in the culture change. At some point, there will be a last stop. And those stragglers will have to decide to get on. Or if they're never going to get on, then the organization's going to have to make decisions about them. That's the unfortunate reality. But right. It's something that will take time. I'm not talking about this train only takes 90 days. This is cultural change like this. It's a multi-month, multi-year endeavor, right?
It's funny you mentioned, because my next question was like, how do you think a conversation would look like between yourself and another CIO in 5 years? And then I said, 5 years is nothing in the healthcare industry. Let's say 10 years.
Yeah, it's interesting. There are change seems to be challenging within healthcare, especially with the adoption of technology and new solutions. But I think the pandemic has taught healthcare systems that they can change pretty radically, pretty quickly when they align and set their mind to it. I think the other thing coming out of this pandemic is there are now financial pressures across the U.S. healthcare system. And the financial pressures, to me, actually, they signify an opportunity. You can look at them as, oh my gosh, what are we going to do? Or you can look at them as, this is an opportunity to actually define change. Because we're whether we want to or not, we're going to have to change. So let's sort of take the bull by the horns and actually define the strategy of how we're going to accomplish that change.
As well as the pace of change. We are now going to play a fun game called Bullish or Bearish. So it's time for you to place your digital bets. I'm going to be naming a technology in healthcare, and you're going to tell me if it's bullish or bearish. All right, let's start with the first one. Number one, telehealth.
Bullish, as long as the government aligns its support. That's the main issue that's still remaining.
Explain.
The PHE or public health emergency declarations has been sort of the license to allow telehealth to continue to occur in its sort of expanded manner. We have yet to actually, at the federal level, make some of the governmental changes that would allow this to continue in and as open-spirited as a manner as it has during the pandemic once the public health emergency declarations end. So, and I do think the government will do it. They're just not being forced to do it as these PHEs continue to be executed.
Got you. Okay, number two, bullish or bearish, wearables.
I'm bullish on wearables. I paused a moment because wearables generate an incredible amount of health data, and we have to be cognizant about how that health data gets consumed by a health system. If it comes in as completely unsolicited information or data, that creates a challenge for health systems in being able to make sure that they're reacting and responding to it, because there aren't intelligent triggers built into many of our platforms and solutions today. I think as that segment matures, the opportunity in the wearable space will really skyrocket.
Conversational AI.
Big growth. So I'm bullish on conversational AI for sure. I was a huge fan, early adopter of actually conversational AI when it was just called NLP, and then it became NLU, and then it became conversational AI. So I've been following it for over a decade, probably about 15 years. I think we're on the cusp of it. There's certainly been a large growth in the number of companies in healthcare specific conversational AI. I think we're starting to see some of those companies take an early lead, because not all conversational AI is equal. Mm-hmm. And I think some of them have pretty significant limitations in how their concept of how they construct the interaction. Mm-hmm. And I think we're going to start seeing, my belief is the latter half of 2022, we will see somewhere between 2 and 6 of the companies in this space really start to delineate themselves separately from the tens to hundreds of other companies in this space, because of how they use intelligence to create the richness of the context, but also allow the looseness of the conversational interaction.
What do you think would be the differentiator that kind of breaks apart the best from the rest?
The ability to efficiently and effectively ingest new knowledge mapping and context creation. So, for example, you mentioned you're with Hyro. So Hyro is partnering with a Find a Doc scheduling type of application, Kairos, and the ability to ingest all of the content that's generated from that and then have that mapped into the intelligence that you're using. If you can do that more effectively and efficiently than other entities, I think it will separate you from that. And so I think there are some really interesting opportunities and use cases, whether it's Hyro or some of the other conversational AI companies. I think, and then there's also a couple different flavors. I think there's companies like yourselves and others that are in what most people would look at sort of the front end of the clinical experience or the administration of getting into the clinical experience. There's also some companies that are much more in the mix of the clinical interaction. And I think they could be merged into one domain, but what I'm seeing right now is that most of the entities are choosing to be in one domain or the other. They're not trying to do both all at once. That may be just more of maturation of these companies and of the solution set, and just the state and time that we're at. We may see that all sort of coalesce into a single entity company that can actually do all of that. That remains to be seen, though.
Right. What do you think of the phrase digital front door?
I'm not a big fan of digital front door. Sometimes it makes me think of smoke and mirrors. Like, there's this fancy digital front entry, but then you get inside and everything is like carbon-based, very manual. I'm much more interested in not only just having a digital access, but an engaging digital experience, right? And the front door aspect, I get how that's used, but I think that unless there's something on the other side of that door that continues the digital experience, that we're not really completing the thought, and therefore the experience for the patient or the consumers that sort of engage. I think that we need to get beyond just a digital front door, because quite frankly, I'm tired of looking at solutions that companies offer that are digital in one aspect, but result in a bunch of manual workflow queues on the back end, right? We want, not only should it be a digital experience for the patient, but it should be a digital experience for the people who work within the healthcare system to execute, and for as much of it to be automated as possible.
Automated and integrated, and a door that leads to a digital hallway that leads to a nice room. I see what you mean. Very interesting. Yeah. Our second to last, bullish or bearish, remote patient monitoring.
I'm bullish on remote patient monitoring. I think it's been around for a while. I think it got a big lift during the pandemic. But I think the other thing that's occurred is it's sort of on one end of the spectrum, which people are starting to create now, where you have remote patient monitoring, maybe going all the way to hospital at home at the other end. And there's this continuum that's going to leverage different components of a platform, different components of technology. We touched on wearables. Telehealth is all through this space, embedded within it. So I think RPM is sort of one segment of a growing sort of footprint in a changing world related to sort of new venues of care delivery. And many of those new venues of care delivery are going to be, from the comfort of your own home, as opposed to you having to come to the healthcare system.
You're being very nice today with your bullish 4 out of 5. So let's see if this last one makes it through.
Yeah.
Augmented reality.
Probably bearish in 2022. I think if you asked me the same question in 2024, I'd be a little bit different. It's a little bit of I think it's a challenging space because they're approaching AR in a way that it's very endpoint solution driven as opposed to platform for use. And that creates a lot of problems for someone like me when you have multiple different surgical disciplines who are all bringing a different endpoint to you and then you can't implement all of them. So I think it's a little bit of a fragmented space right now just because of the state of maturity it is in. Mm-hmm. But I do think that as it matures over the next couple of years, that will change. Even with augmented reality, there's concepts of sort of digital twins in healthcare that are starting to come in where you could construct a personalized health plan based on who your digital twin is. I think all of that it needs more percolation time, I think.
Right.
And as opposed to, hey, here's new technology, let's try and throw it at this. I think there needs to be more thought around it. That's frankly kind of what happened with telehealth through the pandemic. It forced a lot of thought around it and how to better integrate it, because in many healthcare systems, telehealth coexisted with traditional care delivery. And then the pandemic forced them to merge into part of how the operations deliver care. And so I think, it's a point in time. Maturity within that realm will, I think, change from something that I think is bearish today to bullish in the future.
Are there any emerging technologies on your wish list when it comes to the digital patient experience? Something you wish that, existed today?
I think the challenge that I have today, and I think many of my colleagues do, is we've got technologies from multiple different generations of technology life cycles. And many of the newer technologies that we just chatted about, they're very focused on a narrow segment, and they're not taking a more holistic or platform approach. And so it creates a lot of challenges in integration and stringing all these things together. And so I'm much more interested, I think, as the different segments mature, I am hopeful that there will be someone or multiple entities that end up creating platforms that allow us to plug and play on top of that, so that we can sculpt and create sort of the UPMC curated experience, which might be what I would hate to see is that all of the experiences look and feel exactly the same, because I think that all of the healthcare systems, they potentially do have something unique to offer, and how they interpret healthcare delivery, how they manage the culture that they have in care delivery. And I want to make sure that that piece that's unique to UPMC is able to get expressed within the platforms we use. So I think it's taking these pieces, hopefully they congeal into some sort of a platform approach, allow us to then leverage our multi-generations of different technologies into something that creates a seamless experience, both for our clinicians as well as the patient consumer.
What is the best career advice you've been given?
Don't limit yourself. So I think the other one is don't be afraid to say no. I think, and early on in my career, I think I was so eager. I said yes to too many things that diluted my ability to be successful at all of them. And I think that that's a trap that many of us fall into. Certainly I did. And I think you have to be willing to say no to certain things. And then I think the last thing is reserve the opportunities that fit your unique skill set for you. I think that's really important, to try and really focus on what are the things as my role or my skills or what I'm asked to do, what are unique that I can do, and focus on those. And don't be afraid to ask others to partner in the aspects that might not be unique to you, but might be unique to them. I think you ultimately get better collaboration, and you also get a better end product or end result for your organization, which translates into better results for the clinicians and patients.
Mm-hmm. Very nice. I love that question. It always, people always kind of give a very refreshing answer. And lastly, Rob, who do you view as a trailblazer in the healthcare IT industry that you'd actually like to nominate as a future guest on our podcast?
I think David Feinberg, his role as the CEO of Cerner and his past experiences would be a unique one. I think, I just saw today that the Oracle acquisition of Cerner completed. So one of the other people that I think would be quite interesting is Mike Cecilia. He's the executive VP at Oracle, who is going to oversee the relationship of Cerner underneath that acquisition. And so I think a lot of people would like to not just understand sort of Mike's past experiences within technology, but how he sees his role in Oracle facilitating how Cerner moves forward. Another person that I work with a fair bit, who's also in the conversational AI space, is Shiv Rao. Dr. Rao is a cardiologist here at UPMC, who's also the CEO of a company named The Bridge. I think he is a unique leader within the conversational AI space. And he shares the same sort of passion on what and how we think appropriately capturing conversations could actually move healthcare forward in a very significant manner. I think those
Great.
2 or 3 individuals would be wonderful to have in the future.
So my 3 musketeers, David, Mike, and Dr. Rao, we are coming for you. And Rob, I want to thank you so much again for sharing your invaluable insights. And it was great meeting you in person at Becker's. Hopefully see you at the next Becker's. And
Yep.
perhaps Vive, what is the next industry event you'll be attending?
I just went to AMIA's Clinical Informatics Council or conference in Houston about 2 or 3 weeks ago. 2 weeks ago. I think it might be Vive or Health, HLTH, one of those events coming up in the early fall. And I think I just saw an email, might be going to the Becker's CEO 7th Annual Health IT and Revenue Cycle Conference. They were reaching out about having a conversation of the importance of sort of CMIOs and how CFOs should think about partnering and working with them.
Amazing. Well, we will see you there. We'll be at Health. That's in November. Vive is in Nashville in April. Thanks again for everything, Rob, and we'll see you soon.
Okay. Thank you, Leah. Bye-bye.
Thank you for listening to Patient Journey Pioneers, brought to you by Hyro. Subscribe to our podcast on your favorite listening platform. See you on our next episode.